episode of The Human Angle. We begin today with updates of Nigeria's COVID-19 cases. Currently, there are 12,801 confirmed cases, 4,040 discharged, and 361 deaths. On today's episode, we'll be looking at the gradual easing of the lockdown in Nigeria, Phase 2. The Lagos State government has provided the Register to Open initiative for registration of all religious and social centers within the state. So if you own any of these classified businesses, that social clubs, event centers, restaurants, bars, nightclubs, spas, cinemas, and gyms, you need to register to open your business. This process also applies to churches and mosques, and to register, you need to visit the link lasgsafetyreg.com showing on the screen below. You also need to provide your business registration number, a valid email address, phone number, the internal space size in terms of square meters, current maximum capacity, that's the number of people you can accommodate, the number of staff, number of conveniences available, safety policy document, this is actually optional but recommended, and also your Lagos State compliance certificate, and up to 6 pictures of your business premises showing the front entry, the interior, exterior emergency exits, and so on to complete your registration. When completed, you would receive a mail confirmation with your unique identification number. Keep it safe. The Lagos State Safety Commission will contact you within 7 to 14 days to carry out a virtual or physical assessment. We have on the show my colleague, Mr. Otobasi Abasiekong, who is joining us to engage on the subject. Mr. Otobasi, great to have you with us on the program today.
Thank you for having me on the show, Taiwo.
So basically, we've seen that there's been quite a number of things coming up on the opening of, or reopening, yes, really, of after the lockdown. What exactly are your reactions and your perspective concerning this, even in terms of Lagos and other states?
Yeah, you know that Lagos remains a very key state in Nigeria. Apart from being the economic capital of Nigeria, it is the epicenter of the current COVID-19 pandemic. It has, at the moment, over 5,000 cases. And they will not play with the process for reopening social centers and religious centers. So those measures are very stringent, but are very important to ensure that if they have to reopen, there are procedures that have to be followed. So the Lagos Safety Commission has come up with that procedure. And it's important for everyone that has a business in the social circles and covering event centers, nightclubs, and social centers. And then, of course, the religious organizations to reach out and engage this platform. It's a digital process. I expect that the engagements should be less of physical but more of digital driven, and data is very important in collating to know how many, because this will be an avenue for Lagos to also collate more data. We know that the population is estimated to be over 18 million. So Taiwo, Lagos cannot afford to play with reopening process. They have to make it effective for the sake of the population. So within the 7 to 14 days after this religious and social centers follow the process, there will be an inspection, and then they will look at everything and agree on when they can reopen. So this is the first step, and we hope that all stakeholders will respond appropriately and engage that platform.
But extending it to other states, do you think that this should also be applied? More so that right now there haven't been any really information on when we'll be allowed to have interstate travels. Yeah,
other states will follow measures, because if you look at the stats, it's very important to look at the stats. About 3 states have under 20 cases. About 10 states have under 20 cases. Then for over 50 cases, there are 4 states. Over 100 cases, there are 6 states. Over 200 cases, there are 3 states. And over 300 cases, there are 6 states. When you look at states that are over 500, that's FCT, and then Kano has over 1,000, and then Lagos. So all those states, looking at the number of cases they'll have to respond appropriately and see how they manage the process. Because where you have like 3 cases, like Kogi State, you now know that the approach you have to take is ensuring that it doesn't spread. Because Lagos is going to be very stringent, and the level of Lagos, Kogi may not be so strict, but all the protocols must be followed, like it's done globally, whether it's New York, epicenter to crisis, compared to Florida, or even to other parts like Texas. So states will follow appropriately the cases they have, and then put out the measures. The protocols must be followed, but the measures, in terms of reopening, has to be also thought through in a way that reflects the number of cases. That's why you see that some states across the world, some states may reopen because they find out that I have 2 cases or 3, and this has spanned for 3 months. Even like Sokoto has said that they are COVID-19 free. That's one state that's come out to declare that COVID-19 free, but more assessments have to be made in that regard. There are some countries that have come out to say we are COVID-19 free. So they still have to lay that protocol, but they will not be very strict in the way they open activities in the economy.
But let's look a little bit into the businesses registration process. I mean, thinking about it, there are actually some businesses that are not registered. And one of the needs to register is having a business name, having some documents in place. Do you think this is actually, because really, it means if your business isn't registered, then you probably cannot open.
A good way of beginning to register business, collate them, bring them into the net, because those people will have to send a request. And I also hope that the Lagos State Safety Commission and the various agencies involved with businesses will work together to see what they can do for those businesses, because they also have to operate, but they must be willing to also come into the bracket and then begin to also provide revenue and tax to the government, because governments also look at how many business operations do we have, and we have to be accountable to the people. Security and safety, like I said earlier, when we discussed this before.
I would like to say that this is not even just with businesses as well, churches. I mean, I was reading something earlier on in the day, and then I was there on Twitter, and then it was talking about the fact that if you work from, or someone told me rather, if you walk from, say, Lagos to Ibadan, you can count the amount of signboards of churches and even mosques, majorly churches anyway, on the road. So it really doesn't only apply to businesses, but that process of registering your business is actually essential. Let's move on to the NCDC testing. What efforts?
Nigeria Center for Disease and Control, there was a period in the first 2 months when we had the lockdown from end of March to like end of April. We were really operating under 10,000 sample tests, which showed that we needed to step up. And then the NCDC, led by Dr. Chikwe Hekwaze, was able to reach out to private sector, to various other stakeholders to say, innovations we're open to innovations, we're open to support in ways we can ramp up tests. And remarkably, from that under 10,000, we can see now that we have over 79,000 sample tests. That's why you're seeing that the confirmed cases are over 12,000. You're seeing the number of recoveries because of the ramping up of tests, which is very important. And then from 4 testing labs in the country, as at when the lockdown started, in ending March to mid-April, then down to ending April, we now have 31 testing laboratories across the country. We also have seen that the NCDC has brought out a roadmap document on improving tests and improving response to pandemics and disease control. So a lot of efforts have been put in place. And interestingly, the president, Muhammadu Buhari, has engaged extensively the NCDC, allowed the NCDC to do its job, taking advisory from the NCDC, working with the health ministry, which, like I like saying, compared to some leaders across the globe, they're always in tango. I'm sorry to use the example of President Jair Bolsonaro, who in the space of 2-3 months sacked 2 health ministers. Today, Brazil is a hotbed of coronavirus. So you can't just lead a country and then treat the health ministry or the experts like outcasts. You have to work with them, because coronavirus is not a joke. People think there's a school of thought that feel that this thing is a joke, that people are using this thing to collect money. I mean, it's interesting to hear people, when you see what's happening across the globe, and even isolation centers reports and things like that. It's something that in the course of the week, I know that your team, you'll be looking at developments there. People seeing what's happening there, it would be nice to get reflection. It's not a joke.
But let's take it further down on testing. I know earlier on there was talked about having home-to-home testing in Lagos State. But really, there's really not been so much noise on that anymore.
The Health Commissioner, Professor Kina Bayomi, has been working extensively with his team, coordinating the efforts of trying to improve and increase that contact tracing across homes in Lagos. Don't forget that the population is massive. For example, when you know that Lagos also is home to slums, massive slums. I mean, United Nations Habitat complained that this is where you see slums and you're worried that Nigeria with enough resources has huge slums. So the whole architecture, the whole framework has been worked out. Some areas have been covered, but there's still more room. But I must say that Lagos, in terms of the leadership from the governor, Mr. Babajide Sanwo-Olu, and the health commissioner, Professor Akin Abayomi, they've worked extensively to see how they can really ramp up. And that's why I'm saying that you're getting a lot of cases, updates, and reports from Lagos State on the coronavirus pandemic.
Okay, finally, on the reopening of the of businesses and with the rising cases, is this something you suggest that should take effect in terms of bringing in businesses to reopen, and then we have cases coming up?
You see, the chairman of the Presidential Task Force on COVID-19, Mr. Boss Mustafa, was saying recently that the states will play a critical role in the way they respond to public health. So the way they respond and are able to manage the situation, the state governors will be able to sit at the National Council of States level with the Vice President or the President and the NCDC and the Health Ministry to agree that, okay, these are our next steps accordingly and how this are going to move. And like I earlier said, there are states that have under 10 cases, there are states that have over 20, there are states that have over, so they'll have to look at that aspect of how they begin to reopen. But the protocols must be observed, the physical distancing measures, the sanitization, using hand sanitizers to clean hygiene environment. And most importantly, the environment is very important too. How we keep our environment clean is very important. How we manage medical waste is very important.
I think really maybe this is a positive take we can have from this pandemic is the fact that there's been the awareness to be more health conscious and be more be clean. Really, that cannot be overemphasized. And I hope that it's something that would, even beyond the pandemic, is something that would inhabit.
I'm also happy that a lot of investment are going into the medical research. We used to hear about Nigerian Institute of Medical Research, but now we're seeing that a lot is going there. So, I mean, like you said, environment and health awareness is very important. But we must keep our environment clean. And state governments should invest more in ensuring that we clean up the environment and manage especially medical waste this period.
Thank you so much for joining us.
Thank you so much, Taiwo. It was nice having this conversation with you.
On this subject matter.
Thank you.
And that will be all for today's edition of The Human Angle. You can send your comments, send in your pictures, send in your videos to us at news@poshareng.com and programs@poshareng.com. You could also visit our website www.poshareng.com to get more updates from our news stories and videos. Follow us on our social media platforms showing on the screen for further updates on our market reports. See you tomorrow. Thank you for watching, and please keep staying safe.